Nursing school. Nursing is often described as an art and a science. It's a profession that embraces dedicated people with varied interests, strengths, and passions because of the many opportunities that this profession offers. As nurses, we're going to work in emergency rooms, school based clinics, homeless shelters, just to name a few. We've got many roles from staff nurse to educators to nurse practitioner and nurse researcher, and we serve all of them with passion for the profession and with a strong commitment to patient safety. Nursing school is going to become your life for the next several months. It's important for you to educate your family on the time constraints that are required for nursing students. Nursing school is not going to be like any routine college course that you've taken in the past. It's more consuming and it's more difficult. And I don't say this to frighten you, but only to make certain that you go into this with your eyes open. I will tell you, though, that nursing is one of the most fulfilling and rewarding careers that you will ever be involved in. With professionalism and ethics, ethics is an integral part of the foundation of nursing. Nursing students will be expected to act ethically at all times. This entails you being honest with your work, your tests, and following the policies of your school. This also relates to your personal life. It is important to act with integrity and pay attention to what you say and do. Trust me, people will notice and people will say something. For example, future employers often will search social media prior to hiring. So think about what posts that you've made that may put you in a bad light. Professionalism means that you act decorously with good manners and treat others courteously. Professional behavior is part of nursing school, and you will be observed for appropriate and professional behavior throughout your nursing student career, your clinicals, and your lecture. This means that you dress appropriately for clinicals, that you're prepared for class and clinicals. That means that you have the appropriate equipment or you've completed the required paperwork, that you arrive early to your class and or your clinicals. If it starts at 8 o'clock, that means that you're there by 7:45 or 7:50. If you're on time, you will be late. Advising your instructor if you're unavoidably late or ill prior to the start of class. And this is usually done through email. So making sure that you are communicating. You do this with your job. Well, nursing school is now part of your job. Completion of assignments and turning assignments in on time. Understand and remain flexible concerning potential calendar changes. If you have concerns about something in the nursing program, you must follow the chain of command, and this begins with the instructor of a course. Taking concerns to another instructor or going out of order in the chain of command is only going to delay problem resolution. You are going to be held to high standards as a professional nurse, and your training begins with nursing school. You're going to be hearing about a lot about HIPAA if you are not already familiar with it. With HIPAA, you're going to be expected to adhere to the HIPAA guidelines throughout your student nursing career in addition to your nursing career. Violation of HIPAA may result in civil and or criminal consequences in addition to program consequences. HIPAA basically is protecting a client's privacy. Be aware that all of your instructors are rooting for your success. Instructors will be available to help you. But on that note, your instructors are not here to socialize with you. We do have to maintain that instructor-student relationship, but that does not mean that we don't care if you pass or fail this program. Also realize that your instructors or the nursing staff you work with at clinicals may not always instill those warm, fuzzy feelings in you. Well, don't take it personally. We do have other focuses. Maybe a client's status is changing, or we have a headache, or we have personal concerns, etc. So we may not always seem real nice. But on the flip side, if you have personal issues, concerns, etc. going on in your life, your instructors do need to be aware that you have something going on. We don't need the details, but the thing of it is we cannot help you succeed if we're not aware of the issues that may be preventing you from doing your best. So keep us updated. So if you have something going on in your life, it may affect completion of schoolwork, it may affect your focus, etc. We may be able to delay an assignment for you or postpone a test, etc., if you communicate with us. Basically, your instructors are here to help you become our peers. We're going to have fun and we're going to have heartaches along the way, but the instructors want you to be the best nurse that you can be. And we're going to push you to achieve that goal. You may hold our life in your hands one day. Understand that the field of medicine is constantly evolving, and there is no way that your instructors will know everything, but they will guide you in how to find those answers. If you have issues in nursing school, administration will look at how you utilized your resources. Do not wait until you are failing a course to seek help. Instructors are here to facilitate and guide your learning. We are not, we are not here to learn for you. We've already learned this stuff. You will be responsible for your learning, and you will need to adapt to each instructor and/or course. You have to earn your grade. We can't just give you points because you beg us or we feel sorry for you, no matter how much we would like to. You are going to be held accountable and you're responsible for your own actions. Your instructors will provide feedback along the way. It's provided for personal growth. It's not meant to belittle you or make you feel bad. It's to show you areas or ways that you can improve. Your instructors look for ways for you to improve, and sometimes we may have to look pretty hard. But if we don't point out areas where you can improve, you're never going to grow in your skills or your knowledge. We also make an effort to let you know when you do something correctly because you also need that positive feedback. And also make certain to review any feedback that we do provide you on your assignments. So if it's written feedback, this will help you make improvements on your paperwork. Understand that you are all adults. The instructor's goal is to provide each of you with the skills, the tools, and the knowledge base to pass the NCLEX, or the licensure examination, which is a test of minimal nursing competency. Instructors are not here to design the courses to meet your specifications. We have already been through nursing school. We have already passed NCLEX, and we know what you need to pass boards. Successful completion of the nursing program will qualify you to sit for the NCLEX examination. So let's talk about syllabus. What is a syllabus and/or a syllabus addendum? This is a document or documents that are specific to each class, and it will contain required textbooks, give a description of the course. Excuse me, it also lists the grading policies and the grading scales. It lists objectives and course assignments and a calendar. You are going to be responsible for knowing when and what we will be teaching and learning. And your syllabus addendum and/or syllabus can help make a good study guide. It will contain important course information and/or instructor expectations. So really important for you to take time to go through these documents. The class style will be determined by the instructor. The didactic or the classroom portion may consist of lectures, whether they're voice over PowerPoints or a PowerPoint, etc. There may be computer aid instruction, which allows the student to become more actively involved in learning. It may encourage problem solving, which is a skill that employers expect of nurses. It may also require some cooperative learning where you have small group activities. With clinicals may be on campus in the skills lab, it may be in the simulation lab, and it may be part of the facility clinical at a specific facility where real patients are. Some instructors may require what we call a ticket to lab or class or clinical. These tickets may be an assignment or watching of a tutorial. Proof of completion of these tickets must be provided to the instructor to be allowed to attend that class or that lab or that clinical scheduled for that particular day. Your success will depend on you and the effort that you put forth. Again, your instructors will provide the information, the training, and the tools to succeed, but it is your responsibility to use them wisely. The PN program is considered a hybrid program in which course material and assignments are provided in an online format, and there are face-to-face labs, clinicals, and simulation. The ADN program, there are potentially some online courses that you'll be taking. In fact, there will be some online courses, but most of them will be face-to-face. You are going to get out of the courses what effort you put into them. So this will require students to be self-motivated, completing activities over and beyond what are assigned. A lot of instructors will provide optional activities or additional resources for you to go to, different things that you can use to practice to develop your test-taking skills or retention of the content or how to apply the information that you've been learning. It also requires you to ask the instructors for clarification and attending the scheduled student success sessions, etc. If you do not understand something, you have to seek instructor assistance. Don't let yourself fall behind. Nursing courses are pretty fast-paced. There's a lot to learn, and they tend to build on each other. So if you don't learn something and we start building on it later in the course or in another course, you could be totally lost. We start this from foundations and it goes all the way through your last semester, your last course. Courses are going to progressively get more difficult. So again, if you don't understand a concept early on, it will affect your understanding later. Make sure you ask your instructor for clarification. Testing will be computerized. All of your exams will be on school-provided computers. The only item you are allowed to have at your desk during an exam is a pen or pencil. We provide all other materials. This includes calculators, it includes scrap paper, and some instructors will provide candies or mints. And just a little FYI, if you study with a mint and you test with a mint, it does help with content recall. During testing, no hoodies, no jackets, no hats, no drinks, no phones or smartwatches are allowed during the exam. Just leave these items in your vehicle. But if you have to bring them in, let's say you came early and you wanted to study prior to the exam, so you have some material with you, it has to be placed against the walls of the classroom. Nothing can be at the desk with you or by your feet, etc. All phones need to be silenced during the exam, and don't place them on vibrate because that can be just as distracting as having a telephone ring. You are not allowed to leave the room during an exam once it's begun until you have completed it. So make sure you use the restroom prior to an exam and grab some tissues if you feel like you're going to need them, some cough drops if you think you'll need those, etc. Following completion of the exam, do not congregate outside the classroom. There are some gathering areas at the end of the hallway, and it's highly recommended that that is where you go, unless you're leaving after the exam. Also, make sure that all scrap paper stays with your instructor. Nothing that you did not bring in leaves the room with you. Students have to maintain a professional appearance, and this is going to include not only how you look, but also how you speak and how you act or react. This is expected of you every day, and don't forget that it also requires you to act this way, talk this way at clinicals. Professional appearance is going to include your hygiene. You have to remain clean and odor-free. And remember that smoking, if you are a smoker, you don't necessarily smell it on yourself, but trust me that people that do not smoke will smell it. It permeates your hair, it permeates your clothing, it permeates your backpacks and your books, your uniform, etc. So do not smoke around your clients. Um, if you're going to clinicals, do not smoke in your car with the window rolled down. You will still smell like cigarette smoke. It is important for you to be clean, that your attire has to be clean, and it needs to be appropriate for the task. I don't care whether it is in clinical or the classroom. The rest of the class and the instructors don't need to see cleavage. We don't need to see bare midriffs. Dress respectfully. As far as professionalism with behavior, remember it's important to be prepared. This is part of being a professional. You need to have all of the materials you're going to need for the task ahead of you available. You need to keep a neat environment, and this means that you pick up after yourself. Do not leave trash lying on the desks or in the labs, etc. Again, part of professionalism is being present. You need to be in your seat and ready to go by start time. So this means that you have a class that begins at 9 o'clock. You don't arrive at 9 o'clock because, yes, you might be in the door before class starts, but you're not prepared and ready to start. This just delays class time, not only for you, but for everyone else. So I've said it before, I'll say it again. Being on time is being there 15 to 10 minutes early. That way, when doors open, you can be in your seat, have everything out, and you are ready to start at start time. You will be given breaks during class, just kind of depending on the instructor and the class format. Again, email or text if you feel that you're going to be absent or tardy. And this does not mean emailing or texting one of your classmates to tell the instructor. That doesn't count. You need to email or text the instructor yourself. If you feel like you are contagious, don't come to class or to clinical and share it with everyone else. If you're not sure if you're contagious, then maybe emailing or texting the instructor that you're going to be with that day and let them help you determine that. If you, let's say, have had a cough that just doesn't seem to go away, sometimes wearing a mask might be appropriate. Making sure that you're using antibacterial or antiviral gels or wipes may be very appropriate to help prevent anyone else from potentially catching what you may have. It's also important for you to be involved with cost containment. And this means that you are taking care of equipment and supplies. Again, these are things that you would not only do as a nursing student, but you're also going to do them as an employee. If you spend or you tear up equipment or waste supplies, this only raises the cost for subsequent students or subsequent employees. It may prevent getting some of the most up-to-date equipment or restocking an item after it's used, etc. So make sure that you're taking care of equipment and supplies. Be respectful. Also, just an FYI, once you are finished with your skills bags, if you do not want to keep any of the materials that are left in them, we just ask that you do not throw them away. If you don't want them, then just bring them to the school because we do recycle. That way we can make sure that we have plenty of equipment for students to practice with. As far as your actions, always behave as though someone is watching you. The mark of a person or nurse with strong ethics and integrity is the person that does the right thing even if no one is watching. Professionalism regarding verbalization or communication, making sure that you're using appropriate language. This is essential to being a professional nurse. Cussing and or bad language or verbiage will not be tolerated in any manner. Use a please and a thank you to instructors and classmates. Use the appropriate title with all communications. And FYI, all instructors and all of the administrative staff are addressed by professor or Ms. or Mrs. or Mr., um, doctor, etc. So make sure that you use the appropriate title. Written work should contain correct grammar, correct spelling, and professional language. Slang language is not acceptable, not as a professional. Always have a non-judgmental attitude. We accept people where they are. Not everybody's going to be at the same place at the same time. Some people may never be there. There's many right ways to perform different tasks and skills. If staff is doing something differently, ask questions or talk with the instructor privately. For example, I had one instructor tell my students something totally different than what they were being taught in lab. Well, the student brought the concern to me, and I was able to verify with the student where the information is coming from so they knew what information they needed to use. Understand that we are teaching you the textbook in the NCLEX way, which is what you will be tested over all the way through the nursing program and for your licensure exam. So what does this mean? Don't use personal experiences or observations or what someone else tells you to answer questions or treat clients while in nursing school. That's not what you will be tested on anywhere throughout the program or licensure. We also have to be culturally sensitive. We have to be sensitive to someone's values, attitudes, and beliefs, even if they are not the same culture as us. So try to learn about those cultures because it will help you in the care of your patients. You don't have a choice as to which patients you will be taking care of. So you may have someone who has a culture that is completely opposite of what you believe in, of how you were raised, etc., but you still have to treat that person with courtesy, with dignity, with respect, and you can't judge them. Report any problems that you may come across. Privately notify the instructor of violations. We should not be bringing problems up to someone in a group setting. It should always be done privately. And you also need to practice honesty. This is a part of professionalism. This includes copying someone else's work, cheating, discussing the test outside of the testing area, whether the person has taken the test or not, can be considered cheating and also could be grounds for dismissal. Plagiarism. It is okay to view someone else's work, but then you need to reword it. Put it in your own words. Summarize what someone else may have said. Plagiarism is copying someone's word, a large percentage of their work, and not putting it in your own terminology. Honesty is essential to professionalism. And I will tell you, admit your mistakes. We all make them. No one wants to be seen as someone less than perfect, but again, we're human. We all make mistakes. Admit it. With verbal and nonverbal communication, you need to be aware of what cues you're sending. For example, don't sit with your arms crossed. You need to be open to new experiences. You need to be open-minded and listen to doctors, nurses, instructors, or whomever is teaching you or talking to you. You are in this program to learn, and your body language will indicate how interested you are. Try to always respond in a positive manner. It's okay to disagree. Nobody is expected to agree with 100% of what we tell you. However, do it in a professional manner. In today's world, we're surrounded by technology and we must behave appropriately with it. Respect, respect, respect. Or as Aretha Franklin used to sing, RESPECT. Again, make sure that you use appropriate titles. We are not known as, hey. Again, it's Mr., Ms., Doctor, Professor, etc. There should be no bashing of students or instructors at schools or facilities. No foul language is acceptable. And I'm talking, not only online, I'm talking all the time. Keep your comments respectful. Again, you can agree to disagree, but no rude behavior or comments will be tolerated. Don't send emails or postings in all capital letters. Capital letters in technology indicates yelling. Now, I do hold uh, a little caveat to that. Sometimes capitalizing one word or a couple of words indicates that we're stressing a certain word. But understand that with technology, we can't see your expression, and we may perceive these capitalized letters as being angry or disrespectful. It is always recommended that you reread your communication prior to sending or submitting it. Refer to the netiquette document for a more complete list of netiquette behaviors and actions. This is located in your organization course, and some of your instructors have put it within their course themselves. We do know that healthcare and techniques, medications are constantly changing. So as I said before, there is no way that anyone is going to know everything. You're never going to know everything there is to know about nursing. We do know that practice doesn't make us perfect. However, it does help create competence. Excuse me. In your clinical presentation, I made sure to tell you that you need to be practicing during your downtime with your labs. Practice, you can practice just enough to be able to successfully check off, but that does not mean that you're competent in that skill. Never stop seeking new knowledge and staying up to date on nursing practices. Again, things change all the time. And we hope that you will not consider yourself done with learning after nursing school. And we hope that you will continue to further your education. One of the things that we will be doing in nursing school is teaching you how to think. We're going to teach you to think like a nurse. This involves using the clinical judgment model and critical thinking. The clinical judgment model is a tool. Critical thinking is how you use that tool. The clinical judgment model will get you where you need to be with patient care, but you have to use your head, your brain, to make it work appropriately. The clinical judgment model is a systematic way of determining your client's problems, realistic goals, interventions to achieve those goals, and evaluation of those interventions to see if those goals were achieved or if something needs to be changed. Critical thinking or reasoning is using your head. It's deliberate, it's purposeful, it's informed. With critical thinking, it changes with the circumstances. So, in other words, one size does not fit all. For example, you have a client with appendicitis. They are not necessarily going to present the same way that another client with appendicitis will present. And they're not necessarily going to require all of the same interventions. Yes, surgery is going to be the ultimate intervention, but there may be a lot of different interventions in the middle of that. Look for changes in the client or the situation that require you to change how you're approaching each client. Now, critical thinking is a skill, and you are going to be doing a lot of critical thinking exercises to help you build the skill. Develop your critical thinking skills by seeking out real and simulated experiences, and always ask why or what. Why should I do something this way or that way? Why is this happening? What can I do to change this outcome? What can I use to accomplish this goal if I don't have everything I need? Again, you're never going to learn everything there is to know as a nurse, but being able to think like a nurse, you can come to logical conclusions. Thinking like a nurse also requires you to be able to think on your feet. Very few patients have read the textbooks and know how the course of their disease process is supposed to unfold. This means that everyone is not going to present the same. We're going to have differences. Things happen and changes can occur in the blink of an eye, and you have to learn to change course in midstream and take care of whatever new situation may be presenting itself. And then we get to stress realities. We know that nursing school is very stressful. We've all been there. We've been through it. We understand. But understand that you cannot be super mom or super dad or super wife or super husband, super significant other, super anything while you're a nursing student. And don't increase your stress level by trying to be the exception. Just take nursing school one day at a time. Don't spend time worrying about what is ahead because worry only stresses you out. So, how do we deal with stress? Well, we have to set priorities. Determine what you can do without while you're in nursing school, such as some of the social activities. Maybe you need to carpool. Uh, maybe you need someone to help you learn this material, etc. Ask for help. Don't be afraid to hire help if you can afford it or assign chores within the family. I've raised children. Children can help. It may not be the way that you would do it, but at least it's getting done. So assign chores. Tackle one task at a time and handle them only one time. So handle them when they come up. You take off your coat, put it where it belongs. You get the mail and you have junk mail, throw it away immediately instead of letting it set on the counter or the table. It is important to help reduce stress by doing exercise. Now, I'm not saying go to the gym every day or 5 days a week, etc. Sometimes just walking is sufficient. Regular exercise has been shown to reduce stress, even if it's just a few minutes on a regular basis. When you're studying, stop for 10 minutes. Take a short power nap. Read for pleasure. Take a walk. And then focus on now. Don't worry about situations that you don't have any control over or future situations. Worry takes so much energy and it's not going to change the outcome. Deal with the issues as they arise, but not before you need to. Change your perception. What you and you alone control, or you and you alone control how you view things and how you respond to a situation. No one else controls how you respond. Readjust the way you look at negative things in your life. One of the things that I frequently will tell students that come into my office to visit about poor performance on an exam is, I'm just such a poor test taker. I'm so anxious when I take a test. I have severe test anxiety. And the first thing I tell them is stop. That's all negative. You need to start looking at the positive things. You've been studying for this material. You are familiar with this material. You know this material. Trust in your knowledge. Practice self-affirmation. Develop your own mantra, whatever works for you, but make it positive. Put little post-it notes all over your house so you see them as you're getting ready to come to class or getting ready to come take a test, etc. I know this material. I will succeed. Believe in yourself and trust in your knowledge. Also become more assertive. Learn to stand up for your rights without walking over someone else's. Do not dwell on a classmate's perceived circumstances and/or compare your situation to those perceived circumstances. Find humor. Laughter is a great stress reliever. Make sure that you refuel and recharge. This means that you have to get adequate sleep and rest, even if it means putting your books away. Adequate rest is going to promote knowledge retention. Eating regular meals and/or snacks is very important, but make sure they're healthy foods. Again, this will help with your ability to be successful. And know your internal clock. Are you a lark or are you an owl? A lot of people do better in the later hours of the day or the evening. Some people do their best work first thing in the morning. Make sure that you try and accommodate your studying to those times with your internal clock. It's better to work with the natural body rhythms rather than try and conform to someone else's schedule when possible. Positive pampering. You've got to take personal time during nursing school, even if it's only one day a week or 10 minutes every day. You need that pampering time. You also need study breaks. When you sit down to study, don't sit down and study for 3 hours straight because you're not going to remember half of what you studied. You have to take breaks. This means getting up, walking away from the books and the notes for a period of time. That is essential to understanding the content and retention. It is possible to overstudy and overwhelm your brain with information, and that will only increase your stress and decrease your understanding and your retention. So about every hour to no more than an hour and a half, you need to be getting up and getting away for 10 to 15 minutes. Then come back and go at it again. Make sure that you plan time for exercise and fun activities. Establish those healthy eating habits. For example, I usually have a salad for my lunch when I'm at work. So on Sunday, I make all of my salads for the rest of the week, packaging them in separate containers, chopping up boiled eggs, etc. But I get everything ready. So I'm planning for that healthy eating. Plan for activities that provide positive mental stimulation or activities that provide spiritual and emotional stimulation. During your break, again, take a walk, play with a child or a pet, sit quietly and contemplate nature. One of my favorite things to do is to sit outside and watch the birds at the bird feeder. Get a massage. Take a hot shower or soak in the bathtub. Aromatherapy. Music. Deep breathing. Meditation. And my personal favorite, chocolate. 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 I'm not trying to encourage bad eating habits, but each person has individual activities or things that they find relaxing. It's important to discover yours and use it to help reduce the stress that will be inherent in nursing school. So here's a stress reduction kit that might be helpful. They now make a special bottle of wine for stressed out nursing students. Things to do: study, test, clinicals, care plan, skills, meltdown, start all over. Nursing school is a lot like giving birth. Once it's over, you tend to forget just how painful the process really was.